Hello, everyone. Greetings for the day. I'm Sayukta from All About Skin Wellbeing, and I'm sure all of you must be keeping good health. We all know that taking good care of our skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on our skin or nails. Fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infections can look like a rash, which can be really itchy and annoying. So let's connect today with our skin expert, Dr. Senthil Sivaprakasam, live from Chennai, to enlighten us on the topic of fungal infection. Dr. Senthil Sivaprakasam is a dermatologist, aesthetic dermatologist, and cosmetologist from Kilpop, Chennai, and has an experience of 18 plus years in this field. Dr. Senthil Sivaprakasam practices at Radiance Skin and Hair Care in Kilpop, Chennai. He completed MBBS from Sri Ramachandra University, Chennai in 2005 and MD Dermatology from Meenakshi University in 2013. He is also the member of Indian Association of Dermatologists, Venerologists, and Leprologists, IADVL, and American Academy of Aesthetic Medicine. A very warm welcome to you, Dr. Senthil Sivaprakasam. It's a pleasure to have you with us today.
Thank you so much.
So, doctor, today we'll talk about fungal infection, and particularly in this season during monsoon, as you know, most part of India is experiencing rains and monsoons. Are there more chances of getting a fungal infection? And what is fungal infection to start with?
Yeah. So basically, as you said, yes, during the monsoon and the summer season, it's the time when patients get a lot of this fungal infection. It's mainly because of the excessive sweating and the humidity in the climate that causes the excessive sweating, which causes the fungal infection to spread from one person to the other, as well as even to the same person on different parts of the body. So, and fungal infection as such is nothing but it's just caused by the fungus or mycospores. So these are minute organisms, microorganisms, which tend to infect the person, and then also is contagious to other people when people share the soaps, towels, or in gyms when people use the same equipments, and the sweating is a common problem in the gyms. So this is how it's commonly spreads. And also, if when one person is infected with the fungal infection, the family members are at a higher risk because of the nature by which it spreads, as it is very contagious to everyone.
Right. In very brief, you have already explained what is fungal infection and how it impacts a person and also the person surrounded. Uh, Now, doctor, we would also like to know, because in India, it's a very common practice. Whenever we get some infection, we'll rather try to, do some quick fix from our kitchen. We'll try some home remedies, or we'll ask a friend or family who had some similar things, or we'll go over the counter to get something. Now, when we go over the counter for fungal infection, we normally get a combination cream or something which we keeps on using because we are not aware of it. So we'll keep on using that topical, application n number of times, and many times we become resistant to these fungal medications, etc. Now, why it is important to go to a qualified dermatologist rather than doing home remedies or over-the-counter medications, etc.
Yeah. So the reason why it is very important to meet a doctor for the treatment of the fungal infection rather than going to these home remedies or the combination creams which are commonly given by the medical shops or pharmacies to patients is normally fungal infection cannot be eradicated by these treatments. Fungal infection needs a proper antifungal treatment which needs to be taken by the patients for at least 1 to 2 months, or sometimes even up to 3 months, to completely get rid of the fungus. See, it's very common for patients to keep coming again and again, even with the treatment for fungal infection recurrence. The reason is what people normally do is when we give them the medications for a month to follow, they take it for 1 to 2 weeks, and when they see that the skin is improved completely, they think the infection is resolved and they stop the treatment. But what actually happens is in fungal infection, even if the skin is completely looking clear, it is going to take at least 1 to 2 months for the infection to completely get rid of the body. It's not going to happen within those 2 weeks, even though you can see the skin getting completely cleared. And that's when what happens is when they stop the treatment within a month or two, they again get reinfected with the same infection, or because of the incomplete treatment, they end up getting more resistant to the medications. And also, the other family members tend to get infected when they are not completely cured. So this is how it keeps spreading to the same person as well as to the other people. So that's why it's important to complete the full course of the treatment so that they don't get reinfected after the cure.
So I think the bottom line is that A, we need to go and consult a qualified dermatologist rather than going for home remedies, quacks, online influencers, or over-the-counter medication. B, we need to trust our doctor and follow the prescription. Don't stop it all by yourself. Keep the doctor in loop. It's very important to complete the dose, the duration for which the doctor have prescribed you the medicine. So it's very important. And as you said, fungal infection is one which, can be contagious. I can get a fungal infection from anybody else very easily, and especially as we are talking that during this particular time of the year, when it's raining, it's the monsoon time, the cases of fungal infection rapidly increases at the same time. So we need to be more careful. Now, what can we do in a family if a particular member is suffering from fungal infection? What that particular member and the other members can do so that he or she doesn't spread, the infection to others.
Yeah. So the first thing is to not just because when somebody is infected with the fungus or not, the basic cleanliness that everybody needs to follow at home is that everybody should use a separate towel, separate soap. And then when they do these things, the chances of spread among the family member comes down. One. Second thing, if there is a habit of sharing clothes between family members, then that also needs to be stopped, at least not before washing the clothes. After washing, it's fine, but before washing, if they tend to share the clothes, this can easily spread from one person to the other. And when somebody is diagnosed with a fungal infection, say one of the family members, and then there are a couple of other people in the same family, as I said, the infected person needs to keep everything separate, his belongings like the soap, towel, clothes, everything. And the infected members' clothes can be washed separately so that the chances of spread to other members can be minimized. And also, the infected member should use separate bed sheets, everything, so that when somebody uses the infected member's bed, then they can also still get the infection. So these are the common things which they need to keep, be very careful about to prevent the spread among the family members.
Right. Now, we can take care of these in a controlled environment like a family, a house, doctor, where we know that, okay, somebody is, suffering from fungal infection, or in general practice also, let's not share the towels, not use their clothes without being washed and dried properly. But then in public areas, when we are using public transportation or we are going to the same gym, we don't know even the person who just left the bar or the, dumbbells is suffering from fungal infection. We keep on touching the same, rods, dumbbells, kettles, etc. Again, in buses, trains, etc., we sit on the same seat. We touches the, transportation modes. So, what can we do there to avoid catching fungal
Yeah.
infection?
Yeah, see, one common practice in the gyms that people can easily follow is always have a towel with them so that they can wipe off the sweat in case if there's a sweat before using the equipments that they are going to, exercise on.
Mhm.
And as you said, when it comes to the public transport, it's really difficult to clean the seats every time before using them. So the idea is to always stay clean so that whenever you go out and come back home after your work, it is better to take a shower and not reuse the clothes that we use on the same day again before washing, so that at least we can minimize the chances of spread.
Mhm. We also know that you very easily can get antifungal powders, dusting powder, or antifungal soaps. So, in case a person has this tendency of getting fungal infection easily, can they use these antifungal powders or soaps on their own, or especially during this point of time when it's raining?
Yeah, see, using the powder or soap is not going to be very harmful even for a normal person. So it is very fine for a general public to use them if they feel that they sweat a lot, or if they are the ones who have been already infected a couple of times with fungal infection. during the summer or monsoon seasons when they sweat a lot, it is ideal to use these fungal antifungal powders on the skin folds like the groin areas or the underarms where sweat tends to collect a lot. And also, it is okay to use the antifungal soaps on a regular basis for people who sweat a lot. So these are very safe, nothing to worry.
Okay. And again, with our shoes on, especially during monsoons, because most of the time they are wet, not properly, dried. Again, we get a lot of fungal infection cases in our foot, especially between the toes, right? So
Yes,
how to take care of that, especially this time?
yes.
Yes, doctor. Please
So
continue.
yeah, so as you were talking about the shoes during the monsoon season, the one thing that what we can normally do is to change the socks every day, so that it doesn't have to be wet all the time. So changing the socks daily is one good thing you can do. And the second thing what we can do is it is okay to use these antifungal powders even in the web spaces of the toes, so that the sweat that gets collected between the toes can also be prevented with this powder. So that is something that people can use. In case if they have already been infected, then they need to go for a proper course of treatment, of course. But for people who are anticipating that, since they have already got this infection and they want to avoid going through the same infection again, they can go with this correct preventive measures like you changing the socks and using powders on a regular basis.
Right. And doctor, we would also like you to shed some more light about nail fungal infection on nails.
Yeah. See, fungal infection on the nails is not very common as compared to the other fungal infections on the skin. But there are a couple of people who come every week for, nail infections also. But the treatment is completely different when it comes to nail infections because one, it's very difficult to treat. And second thing, it takes a very long time, minimum of 3 to 6 months or sometimes even longer to get it completely treated. Yes.
Right. And what about fungal infection of scalp, doctor?
Scalp, yes, it's common. It's particularly common among the children and sometimes even young adults. And sometimes they can have the scalp infection separately or with other body parts also involved. And when it comes to the treatment part, it is similar to the skin infections, but of course there'll be a few other medications which needs to be given. Plus, it might take slightly longer time than the regular skin infections.
Mhm. Now, the tendency in our society is that we love oiling our scalp, and especially in case we see some, dry scales or anything which is even closer to dandruff, we'll apply even more oil and keep it on our scalp for as long as possible. What should we do, especially when we have fungal infection on our scalp?
See, there is nothing specific. Okay, so the first thing is that if you are infected with the fungal infection, either on the skin or scalp, the treatment course need to be followed properly till the fungus is completely cured. Sometimes the medications are continued at least for a couple of weeks to a month, even after the complete cure of the fungus, so that the recurrence can be prevented. And when someone is infected with the scalp fungal infection, there are specific antifungal shampoos which really help a lot in reducing these infections, which can be used on a daily or on a basis which is prescribed by the specific doctor based on the patient's lifestyle and other things. And also some creams which needs to be applied externally on the scalp also needs to be used regularly.
And oiling helps, doctor?
Oiling normally doesn't help much with the treatment of fungus infection, but there are studies which say that oiling can actually increase the chances of getting a fungal infection or can even cause a problem with the treatment. When someone has a fungal infection of the scalp, it's always better to avoid oiling the scalp on a regular basis.
Okay. And doctor, what are the treatment options available for fungal infection, specifically on skin, if we start with?
See, the infections that are available, I mean, the treatments, if you see, there are a lot of tablets which are available, antifungal tablets, which can be used regularly. And they are given based on the intensity of the fungal infection and the spread of, how much it is spread on the patient. Based on that, the duration is decided. And sometimes even up to 2 or 3 months, we give the medications based on how it is improving. And there are multiple different medications nowadays available to treat the fungus based on how severe it is. And these are the main things. And of course, to get a more comfortable feeling during the treatment, to reduce the itching sensation, we give some medications for the itching to come down. And also some creams are given to reduce the local inflammation of the skin, the redness and the swelling that sometimes happens on the skin due to the infection.
Okay, doctor. We have one viewer with us, Kirti Kapoor, and her question is, how can I maintain good skin hygiene to prevent fungal infections in the future?
See, the basic thing is to always use, as I said, the separate soaps, towels, and take a shower 2 times a day if you're sweating a lot or if you travel a lot. And these are the most common things. And then, of course, taking care of your belongings when you go out, travel a lot, avoiding using the other sharing beds with other people when you travel, or using clean beds and bed sheets when you travel to hotels. So these are the most common things that you can normally follow to make sure that you don't get the fungal infection.
Okay, doctor. Doctor, during pregnancy, a woman can also get fungal infection, right? Again, during lactation, a woman can get fungal infection. Now, my question is, because we know that during lactation or pregnancy, you just can't prescribe anything to the lady. Over-the-counter product, I'm sure, is a big no-no, especially if a person is pregnant or lactating. Now, in that case, how do you treat a fungal infection?
See, when it comes to the pregnant or lactating women, normally we avoid giving the oral antifungal medications, okay, for safety reasons. And it's normally treated with just the creams or lotions and the soaps.
Okay, right. So, and specifically, I think it's important to, aware the pregnant women or lactating mothers, please don't go for over-the-counter medications. Please go and consult the right person, which is again a qualified dermatologist. Please, a big no-no for over-the-counter medication. Now, many times we have seen that, people who go for over-the-counter medications become resistant to, these creams. What's that scenario, doctor?
Yeah, see, the problem is using just the creams is not going to treat the fungus completely. So what happens in the long run is each time they go for these different creams to get it treated locally, they are causing more of a resistance so that the fungus becomes more resistant to that topical cream, that it stops responding to one particular medication. And then they keep using all the other medications available, and at some point it becomes so difficult to treat these people that most of the even the oral medications stop working in some of them, or even if it is working, it takes a longer duration to get it treated. So when someone is become very resistant to fungal infection, that's when the multiple medicines are given together and for more longer durations to get rid of it or to control it to a better extent.
Okay, we have Tina Bhargav with us. Her question is, can a fungal infection come back after successful treatment, and what can I do to prevent recurrence?
Yes, it can definitely come back even after a successful treatment. So the only way to prevent it is to be very cautious and taking precaution in making sure that you don't share your personal belongings with others. That's the only way to avoid it. So you can't avoid it by any other means.
Right. We would also like you to tell us, doctor, how does this fungal infection looks like? Because there are so many, infections that we normally get on our skin. Plus, in almost every kind of skin infection, we do get a rash, which is very itchy and annoying at the same time. So how to differentiate, how to know that, okay, this is fungal infection?
See, it's not very, all fungal infections don't look the same. So it might not be easy for a normal person to differentiate every infection by just looking at it. I know it's always best left to the doctors who are well trained in diagnosing these infections. But for common purposes, if someone is doubtful of whether they have a fungal infection or not, the most important thing to look for is one, it can easily be very itchy, and the itching is more when they come in contact with the sweat, particularly during the daytime when it is very sweaty. And the patches are mostly round in shape, and they are more commonly visible in the groin area, the hip areas, the folds of the skins. So these are the things that someone can, if they feel that these are the things that they have, which, or rashes which are similar to this on the body, then it might be a fungal infection. Of course, there are some other conditions which can mimic these, but most commonly these are fungal infections.
Okay. And when a person comes to you with the fungal infection, how do you diagnose? Is just through the clinical investigation, or there are various tests as well?
Mostly fungal infections are diagnosed by in the clinic itself by just looking at them. Okay, and in very rare instances, if we are still not very clear about whether it is a fungal or not, then there are other investigations which can be done in the laboratory as well. But majority, 90 to 99% of the times, it is done mostly by examining the patient.
Right. Many times patients ask doctor that how much time will it take to completely go away, and how long normally the treatment is.
See, the most common duration of treatment is between 1 to 3 months based on the intensity of the fungal infection. So, some can completely get rid of it by 1 month's treatment if they come very early in the disease stage progress, and if they are coming a little too late after the spread is very too much on the body, then it might take up to 3 months in some patients.
Right. And many times, again, for the same reference, people will ask that, because I have to take this medicine for at least 1 month to 3 months, is it safe to take antifungals for this long?
Yes, mostly it is very safe. It is given based on the patient's age, body weight, and everything. So normally these medications are pretty much safe.
Okay. We have John Verghese with us. His question is, should I avoid certain types of clothing or fabrics to prevent moisture buildup and reduce the risk of fungal infections?
Yeah, so what people can normally do is try to avoid wearing tight-fitting clothes during the summer or monsoon season, so that sweating will not just stay inside the body. So they wearing by wearing loose clothes, you can actually have better improvement on the hair circulation for the body, so the sweating can be reduced. And the other thing is to prefer cotton clothing rather than using all these polyester or denim clothing during the seasons.
Right. So, right choice of clothes or fabrics are equally important. Let your skin breathe. That's the bottom line. So, if you'll keep on accumulating sweat, then there are definitely more chances of catching a fungal infection. Now we have Feroz Khan with us, and his question is it necessary to take oral antifungal medications for nail and scalp infections, or can topical treatment suffice?
No, oral medications are definitely required for treatment of fungal infections, whether it is on the nail, scalp, or skin. Oral is definitely required. Oral medications are avoided only in pregnant or lactating mothers. Other than that, everybody else, it's normally recommended to take oral medications.
Right. We have so many influencers these days, doctor, on social media, and people are following them, like crazy. And these social media influencers have remedy or, quick fixes for almost everything. So whenever they'll talk on the topic of fungal infection, rather than emphasizing on the need of how important it is to go and consult a qualified doctor, they'll, give some quick fixes or do this, do that, lifestyle modifications will help. What's your take on that?
See, fungal infection is not something that can be treated by lifestyle modification or by following home remedies. It is something that needs to be treated with the proper medication to get rid of the infection. If it is not treated in the proper way, the patient is going to keep getting the infection repeatedly, and he is also at risk of spreading the infection to the other family members. So, following lifestyle modifications may be good for certain conditions, but when it comes to infections, particularly fungal, it is better to always meet a dermatologist and get it treated in the proper way.
Right. Now, what happens, doctor, in practical, scenario? Will go over the counter for some topical cream, and because they do contain steroids and we are not maybe aware of it, we'll keep on applying it. And because, as you said, you see that superficially it's gone, and you feel really good about it. See, I saved all the money that a doctor could have charged me. I just used a cream and now it's okay. But as you said, the deep inside, it's still there. And that's why it's important to consult a doctor and not use just any cream on your skin. Please, I mean, that could be harmful. Now, with this tendency of using a lot of over the counter medication, what are the potential complications that a person
Yeah.
could get?
See, the first thing that I see very regularly in people who come after using all these over-the-counter creams, particularly steroid combination creams, is that the infection takes a longer time to get treated. It doesn't, respond to the traditional treatment in a normal way. It takes more longer duration. Say instead of 1 or 2 months, we need to treat them for 3 to 4 months. And the next thing which I really want to emphasize for people who use these over-the-counter creams is when I have seen a lot of patients, say, in fact, even in a monthly basis, I see 2 or 3 patients walking in after using steroid creams for the fungal infection for such a long time that the skin, becomes so thin after using steroids for long duration that they develop stretch marks all over the areas where they have used the creams. So I see common stretch marks, deep stretch marks on the hip region, the groin area, the skin folds, the underarms. So where they apply the creams liberally, thinking it's going to get treated, and then after using steroids for prolonged time, they develop huge stretch marks, and the skin is very sensitive and red in color because of the damage that the steroid has done to the skin. So it's always better to avoid steroids at any cost for fungal infection treatment.
Right, and that's why we are, repeating it again and again. Please go and consult the right person, the right expert, which is a qualified dermatologist. So don't waste your energy, your time, your money, and most importantly, your health on over-the-counter medication or home remedies, quick fixes, or consulting a friend or family, or even getting influenced by the social media influencers. They're also getting paid for what they are promoting. So don't do that. Go to the right person, which is a qualified dermatologist. Now, as we were talking about fungal infection of scalp, doctor, it's quite common in kids as well. What is the line of treatment, especially for toddlers or children for scalp fungal infection?
See, based on age, we can give either medications. Nowadays, it's available as syrups or dispersible tablets for young kids. And of course, for children, we have dosages based on their age and body weight. So once the proper treatment is given, it definitely gets treated, and the recovery is 100% guaranteed in majority of the people.
Okay. We have Rohit John with us, and his question is: are there any risk factors that make some individuals more prone to fungal infections on nails and scalp?
There is nothing specifically that you can say that that it causes someone to get is in more risk of getting a fungal infection of the nail or scalp. But overall, when it comes to fungal infections, it's more common in diabetic patients, particularly in people who are not under well control of diabetes.
Right. So it's important to watch out for your overall health. It's equally important. Now, what are the most common, say, do's and don'ts, doctor, that we need to, take care?
See, the most common do's and don'ts, which I think we have already been discussing over this half an hour. So the most common things, as I said, is the maintaining a clean environment around you, making sure you take care of all your belongings properly, wash your clothes on a regular basis, don't reuse them without washing, avoid sharing all your personal things like soaps, towels, combs, everything. And even within the family members, it should be avoided sharing all these things. And once someone is infected, it is definitely compulsory to make sure everything, all the belongings are separate. The beddings, bed sheets, pillows, everything are separate. So these are the most common things that someone can follow.
Right. And when you said, we should not share the towels, clothes, etc., especially with someone who is suffering from fungal infection, at a point, maybe we, succeed in doing that and maintaining that, decorum. But the thing is, many times people will not share their clothes or towels, but will share their topical cream. For example, if I have a family member who is suffering from fungal infection, I got the same, we'll use the same cream, which is again a very common tendency, which is again a very common practice in our society. What's your take on that?
See, sharing the cream is okay, but then that's not going to treat the infection. The problem is the tablets are also more important to treat the fungus and reduce the fungal load on the body. So if one person is getting the treatment properly done and the other family member is just using the creams, definitely the other person is not going to get fully treated. And now it puts both of them at risk of getting the reinfection, because when the person who's following the proper treatment is completely clear, the other person who is still not completely cured of the infection has the risk of infecting the other person again. So, it is always better for all the family members who are infected with the fungal infection to start and complete the treatment together so that the reinfection doesn't happen within the family.
Right. And before we sum up, any take-home message for our viewers, doctor?
See, the most important thing when it comes to fungal infection is to not get worried. It's the most common thing that people can get. It can be treated 100% with proper treatment. Just meet the correct physician, the dermatologist, to get it treated. And once you follow the treatment protocols properly, there's nothing to worry, and the infection definitely never recovers if recovers if you follow the treatment and you follow all the precautions after that.
Right. So the most important thing is to understand that in case you have any kind of infection, specifically fungal infection, please go and consult a qualified dermatologist. Trust your doctor, follow your doctor, complete the dose, complete whatever prescription have been, handed over to you. That's really important. Thank you so very much, Dr. Senthil Sivaprakasam. It was wonderful talking to you. Thank you for your valuable time, doctor. And it has been a very informative session, no doubt.
Thank
Thank
you
you.
so much. Welcome. Bye.
Bye, doctor. And viewers, thank you for your excellent participation. For more information and updates on skin health and care, stay connected on our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day ahead. Goodbye.